Hello everyone, I'm Dr. Srijitra from Examla Healthcare. Today I thought I'll talk about one of the most common disease that today's generation is facing, cervical spondylosis. Cervical spondylosis is nothing but the wear and tear of the neck bone. We also call it as a neck arthritis. So this disease usually starts at the age of 30, and by the time you are 60, at least 9 people out of 10 would be suffering from cervical spondylosis. That common is this disease in today's generation. So now let us look into the symptoms of cervical spondylosis. Definitely the major symptoms is of course the neck pain. The pain can just localize entirely to the neck, or it can radiate to your shoulders or to your hands, one hand or both hands, depending on how the disease is affecting you. Usually it will not start with pain, but first it starts as weakness and then numbness and tingling sensations, and then the pain sets in. It all depends on how the disease is progressing. So usually there will be pain, there will be stiffness, there will be a bit of bump or lump sensation, and dizziness or vertigo is associated with it, and headache and muscle spasms are also associated with cervical spondylosis. So now let us look into the causative factors. So definitely arthritis is one of the major cause for osteoarthritis. So when the arthritis sets in and it progresses, it will lead to the degeneration of the disc between them. So definitely this will lead to the reduced intervertebral space and also causes stenosis of it. So here what happens is the nerve between the vertebrae will get compressed, and that's how you are getting the nerve pains. So also one of the properties of the arthritis is forming the bone spur or osteophytes. This also can cause the muscle pain and stiffness around the neck pain. And also sometimes there will be herniated disc. This disc also come and compress the nerve and cause you all the symptoms. So these are the causes of cervical spondylosis. Now what do you think is the triggering factors of osteoarthritis? Definitely the age factor is there. After 30 you have to be very careful, especially of your neck. The second factor is smoking. Smoking can trigger inflammation as well as arthritis in your body. The third major factor of cervical spondylosis is too much of bending down. If your nature of work or your nature of habit is too much of bending down in a day, then definitely there is chances that you might end up in cervical spondylosis. In today's environment, children's, IT professionals, even everyone, including the mobile watching, everything it takes a lot of bending down. And if you do that for a long period of time, definitely it will lead to the cervical spondylosis. Fourth cause is neck injury. Neck injury can be anything physical because of any accidents, or it can also be because of the weak bones and muscles. This may be because of the result of low calcium or low vitamin D in your body, because these are the two major factors that helps in strengthening the muscles and the bones. So if you are not supplemented properly with your vitamin D and the calcium, there is chances that you might end up in the many muscle and bone injuries. And the fifth factor is family history. If you have family history of arthritis, then definitely you have to be very cautious regarding cervical spondylosis. Now let us look into the treatment methods of cervical spondylosis. In homeopathy, we have medications to reduce the symptoms of cervical spondylosis, especially the nerve pains, the giddiness, the headache, the muscle stiffness and pains. We have beautiful medications to treat this symptomatically. Depending on the stage of the disease and the progress of the disease, we also advise them some supportive measures, like advising them to sleep without a pillow or to wear a neck collar if it is necessary. So these are the supportive measures usually we advise. And also we have physiotherapy. In physiotherapy, we have specific neck exercises to strengthen the muscles of the neck as well as to improve the flexibility of the muscles. So these exercises, they not just relieve the symptoms of cervical spondylosis, but also prevent these diseases in setting place in the first place. So if you need any details regarding the exercises, or if you are having any doubts regarding cervical spondylosis, you can contact us. We will help you out for more. So if you really enjoyed the section, you please make sure to like, comment and subscribe, and also please don't forget to share it among your friends and families. Thank you so much.